Hey guys, today we're going to be talking about cardiology. As many of you know, cardiologists are specifically trained to deal with patients who have or may have cardiovascular diseases. They are sometimes referred to as heart doctors or heart specialists, but here at Pacific Companies as a recruiter, you will refer to them as cardiologists. Let's do a general overview of cardiology. As many of you are aware, cardiologists are specifically trained in the treatment and prevention of cardiovascular diseases. They are sometimes referred to as heart doctors or heart specialists, but here at Pacific Companies as a recruiter, you refer to them as cardiologists. Cardiologists work in either a clinic or office setting and or a hospital, and they can work as part of a private practice, a single or multi-specialty group, or as employees of a hospital. So now let's talk about training. So what does it take to become a cardiologist? Well, as most medical specialists, you need 4 years of college, 4 years of medical school, and then for a cardiologist, you need another 3 years of internal medicine residency, and then followed by a general cardiology fellowship, which is also 3 years. At this particular point in time, the cardiologist can choose to go into practice as a general or non-invasive cardiologist, or pursue additional fellowships in the areas of interventional cardiology, structural heart, electrophysiology or EP, and heart failure. For this particular video though, we're going to focus mostly on general cardiology. So for the additional fellowships such as interventional cardiology, which is 1 year of additional training, an interventional cardiologist intervenes to help restore blood flow to blocked arteries. An additional fellowship on top of the interventional fellowship would be in structural heart, and that's for advanced heart procedures. An electrophysiologist, or we refer to them as an EP, that's an additional 2-year fellowship, and that's a physician or cardiologist that works with abnormal heart rhythms. And then you have a heart failure specialist, and that's a fellowship is 1 year, and that deals with someone who is a weakening or failed heart. So where do cardiologists work? General or non-invasive cardiologists typically work in a clinic setting, although they may often go into the hospital as well to see heart patients or or to take call. An interventional cardiologist and an EP both work in specific type of labs. A cardio cath lab is where an interventional cardiologist works, and an EP lab is where an electrophysiologist would do his job or her job. A cardiology clinic will have all the kinds of different equipment to help diagnose cardiovascular diseases, and the clinic will also have additional personnel to help run the clinic smoothly. The first type of call is called consults. A consult is when a physician, usually of another specialty, needs the expertise of the cardiologist for something that their patient is suffering from a cardiovascular standpoint. So they may have to go into the hospital and see this patient physically, or they might call the other referring physician on the phone and discuss the patient over the phone. The other type of call that a cardiologist is going to take is emergency room call. So this is for cardiovascular emergencies, more likely heart attacks that are coming into the hospital. The second type of call will be emergency room call, and this will mostly be for cardiovascular emergencies, more than likely a heart attack in this particular situation, where the emergency medicine physician will see the patient initially and then call the cardiologist, who will then come to the bedside in the ER, and then that cardiologist will direct the care of that particular patient. And in this case, that might mean sending them off to the cath lab, which we mentioned earlier, so they can see the interventional cardiologist who can intervene to eliminate the blockage in the artery, or they might even be referred to cardiovascular surgery for surgical removal of the clot. Now you might be wondering, how do cardiologists get their patients? Well, it's pretty simple, but the answer also lies in the type of cardiologist that we're dealing with. So a general or non-invasive cardiologist is going to get a majority of the referrals from the primary care community. So family medicine and internal medicine physicians will refer their patients to cardiologists for treatment. That cardiologist might also then, depending upon what's going on with the patient from a cardiovascular disease standpoint, refer that to the other specialists, interventional, structural, EP, or heart failure. Now, once patients are referred to the cardiologist, you might be wondering, well, how many patients a day does a general non-invasive cardiologist see? And in clinic, the answer to that is typically between 20 and 25 patients per day in a clinic setting. If you're talking about an interventional cardiologist, those cardiologists don't really see clinic patients. They can, but it's not going to be as much as your general non-invasive. They work mostly in the cath lab, where a good volume there would be 250 to 300 procedures per year. Speaking of procedures, cardiologists evaluate their patients using several different methods to determine any type of heart or valvular disease, and if there is disease there, to what extent, and or discover a risk that a patient has of developing heart disease. For a general non-invasive cardiologist, some of the top procedures they might do are an EKG, which is a digital mapping of the heart rhythm, a stress test, which is also a digital mapping of the heart rhythm under exercise, a stress echo, which combines the digital heart mapping along with a ultrasound of the heart in movement. They might also do diagnostic caths, which is an invasive procedure where they stick a wire into your leg and up through your arteries to see if you have a blockage, but they do not intervene. That's what the interventional cardiologist would do at that particular point in time. Lastly, though it's not maybe a procedure, as we talked about earlier, they do cover and treat heart attack patients in the ER, and in this capacity they would really be the quarterback in coordinating all of the care for that particular patient based upon their symptomology. When screening a cardiologist as a recruiter here at Pacific Companies, it's vital that you ask at least 3 main questions of the cardiology candidate that you're talking to. The first and most important would be to understand their training and exactly what type of cardiologist that you're dealing with. As we've talked about, there are several different paths for a cardiologist to take. Make sure you understand their practice, patient volumes, and if they're doing any procedures, and if they're doing procedures, if so, and how many. And finally, you want to make sure that you understand their call schedule that we talked about previously in detail and how busy their call schedule is. And this will help you get a good idea of what you're dealing with in terms of your cardiology candidate. Well, that's our review of cardiology for now. If you have any questions about this specialty, please see Chris Call or any of the senior recruiters here at Pacific Companies. Thank you for watching, and we'll see you next time on the Pacific Companies Introduction to Medical Specialties video series.